Thank you for joining us. I really appreciate the support you continue to show us since the launch of this channel 3 weeks ago. Kindly continue engaging us on the comment section. You can also like and share our videos. If you've not subscribed to the channel, please subscribe using the subscribe button below. Last week we discussed the impact of COVID-19 pandemic on maternal and child health services. This week we go a step further to discuss how you can navigate pregnancy during this COVID-19 pandemic. Joining us is Louisa Muteti, the chair of the Midwives Association of Kenya, to discuss this subject. This is Mommy Talks with me, Karong'o. Thank you for joining us today. Why isn't it important for mothers to still go for antenatal care visits despite the current situation or the current crisis?
It is very important for mothers to go for antenatal clinic. One, because they will be able to be assessed to know their status in terms of even that COVID. Do they have enough blood? And even if they have enough blood, what is their blood group? What is their rhesus? Could they be having any other underlying condition that can jeopardize the pregnancy or the baby? Which is very important. And they can't know it unless they go to the hospital to get these assessments done. Many mothers think that they need to go to the clinic when they are maybe 5-6 months, which is a very serious mistake.
The concern that most have right now is whether the hospital environment is safe for them to go and have their normal clinics.
It is safe because the areas where there are COVID patients being taken care of is already known and fenced off. There is also the assessment which is being done to be sure that everybody coming to the hospital is safe. And again, with the Ministry of Health guideline of using the face masks, it is advisable everybody going to anywhere, and the hospital is a public place, should go with a face mask. And that would help even when they are getting assessed, they are safe.
What are the risks of letting the fear get into you and failing to go for the clinics?
It's a very serious challenge because if, for example, somebody, when they were getting pregnant, they got an infection together with the pregnancy, for example, HIV or syphilis, they will not know. And this now jeopardizes the pregnancy and the outcome of that pregnancy. For example, syphilis can be treated within 3 months. If it is not treated, the baby is born with syphilis. So the chances of that child surviving is very minimal. Sometimes they are even born dead. That is what we call stillbirth. And the mother may have perpetual challenges in health because they never even knew what was going on.
For mothers who may go to deliver and they are confirmed or suspected to have COVID-19, how is that handled?
There are people who are conducting deliveries also. There are those who are trained on how to assess and manage COVID-positive mothers. And there is a section for that. They are not mixed with others who are not. So there is no any good reason for mothers to be scared or to be afraid to go to the hospital. These issues have been addressed already.
So do they have to go through CS?
No, not necessarily, unless there is an indication for cesarean section. COVID is not an indication for cesarean section.
Can it be passed on to the unborn child?
So far, there is no evidence that has happened. But otherwise, the researches are still going on. I will be able to know whether it does or not. But so far, it has not been confirmed. There is no evidence as such.
There is also the concern of breastfeeding. If you're confirmed to have COVID-19, should you breastfeed your newborn? Or if you are a mother who is breastfeeding and you're confirmed to have COVID-19, should you continue with breastfeeding the child?
Unless somebody is very weak, they are encouraged to breastfeed, but they maintain the issue of personal and environmental hygiene, which is very key. And because they are COVID positive, they need to use the face mask to protect their newborns. Yeah.
Talking about protecting newborns, how can you protect them at the hospital and also at home from contracting the COVID-19?
The protection is maintaining the personal hygiene and being able to protect the breathing to the baby, and this helps the baby not to be given any droplets as they breathe. So even in the hospital, there are areas where the baby is maintained to support that. If the mother is staying in the hospital, if she has moderate symptoms, if she's asymptomatic, she can be supported with home-based care now to know how to manage herself at home with her baby.
Given the current situation, there is always that bag that the mother carries when they are going to hospital. Are there any special items that they should pack when they're going to the hospital now?
The routine things that mothers carry should be there on top of their personal face mask additional. You carry your pampers for the baby, you carry your cotton, you carry the clothes for the baby, you carry your changing clothes to come home with, you carry extra wrappers for the baby and extra wrappers for yourself, like the lassos. At least you should not just carry one, you should carry at least two, and wrappers for the baby, baby shawl, clothes for the baby. And most of the time it's better to carry unisex clothes, because you may have been thinking you've got a girl, you end up with a boy, or you thought it was a boy, it ends up being a girl. And then now what you had now is the face mask and the sanitizer plus the soap. And where there is challenge of water, it's good to carry drinking water also. In some places, some hospitals encourage mothers to come with their own bathing basins, so that when they use, they just go. They don't want sharing, and even a cup for drinking with your water, so that you don't share. Yeah. And possibly even a plate and a spoon, so that you don't share, because the sharing can easily create cross contamination.
We are also seeing mothers who are afraid of taking their children for routine vaccination. What are the implications of this?
The diseases we are preventing with immunization, if the babies are not protected and a good number is not protected, most of these things are in the air, then the baby is at risk. Most of the areas where the immunization is being done, mothers can even call and book an appointment for the immunization, so that they are told, come at this time, and they go get done, they get the service and go home. Most places have got a telephone for them at the MCH for mothers to pick and call. There is also an hospital number which they can call and get connected to the area of immunization. That's the MCH. And they will come and get the services. I wouldn't encourage a mother not to go for routine immunization because they are fearing COVID. Because COVID is already taken care of.
What would be your final advice to mothers?
As soon as they miss their monthly periods, they should be able to go and get assessed to know how their systems are. Because that way they will know if they are pregnant. Then they can start their routine supplements to boost their blood. One of the reasons why they should go early is to know how much blood they have, in case they have got high blood pressure, or they have got sugar, or any other condition which can jeopardize the pregnancy. When they go early, then it becomes easy for them to know how they are for further analysis along the pregnancy. And that way they are assured of getting a healthy baby and themselves being okay. It gives them peace of mind.
Thank you so much for your time. That marks the end of our episode today. See you again next week when we discuss the do's and don'ts in taking care of a newborn baby. Until then, stay safe and goodbye.